The government has defended the criteria it used to select beneficiaries of the cash transfer program during the coronavirus pandemic. Speaking to Citizen TV, Labour and Social Services Cabinet Secretary Simon Chelugui maintains that they went for a manageable number that was in dire need. But as Enock Sikolia reports, the Cabinet Secretary says the government will have to widen its net given that the strain the pandemic will have on the economy and on individual incomes.
Millions of Kenyans, the country's most vulnerable people, are at risk because of the coronavirus pandemic. According to the World Health Organization, neglecting them might in the long run hurt everyone.
We are just targeting the most vulnerable, the poorest, and also the weakest.
The United Nations says COVID-19 could turn out to be the worst humanitarian crisis. Since the outbreak, hundreds, if not thousands of Kenyans have lost their jobs. Some have been affected by the night curfew. And even though the pandemic has disrupted the lives of many, there is a group that is more affected, the vulnerable. Chelugui says the government has upped its existing cash transfer programs, targeting over 1 million people that receive 2,000 Kenyan shillings per month. He says that the last beneficiary received money on Monday.
I cannot say they will solve all our challenges, but we just want to pick on the few that we think we can afford and continuously support.
The program has targeted senior citizens aged above 70, the extremely poor, and those with severe disabilities. But concerns have been raised over how beneficiaries were picked.
When you say severe, means somebody who cannot help himself. Maybe he doesn't have eyesight, both eyes are not there, or he has broken limbs, or he has any kind of disability that may disable him from earning or working or being productive.
But then there is an additional 10 billion shillings funding meant to support the vulnerable groups, including the elderly and orphans, during this pandemic period.
Because of this pandemic, we need to also reach out to those other people who are left out. And that's why we have to employ multi-agents approach to map. We begin with the urban poor, like Kibera, Korogosho, Mathare. There are people who are very poor in the urban areas, in Mombasa, in Kilifi, towns and counties that are now under lockdown.
But the criteria of identifying beneficiaries is proving to be a challenge.
Because we have people even who are not eligible, but now they are eligible. They lost jobs, they are not earning, and they are breadwinners in families. And they will require that kind of cushion.
And then there are people who have had to leave their homes, displaced by floods or ethnic animosity and banditry. Enock Sikolia, Citizen TV, Nairobi.